As I reflect on this project of addressing childhood obesity, I was surprised to learn that Georgia ranks 17 in the nation of obesity for children's ages 10 to 17. As I learned more about the body mass index and how it measures the body fat based on height and weight, I learned that it doesn't take much to be considered obese. At my job, we are responsible for getting the weights of all patients when they come in. And I learned that the explanation point next to some of the weights meant that my patient was considered overweight based on the average height for their age, which means that my grandson is basically overweight and considered in the obese realm percentile, regardless of how tall he is. I also learned that obesity could be a primary and secondary cause for long-term illnesses such as asthma, diabetes, and heart disease in children on into adulthood. Most importantly, I learned that in order to make physical changes, you must make the change mentally in order for it to take effect. If parents are in denial or on defense about their child's obesity status, then they will not receive the educational tools needed to address their child's obesity. Some of the changes that had to be overcome was my perspective on what I felt was important for a child's health and well-being, of making this a priority and many people not seeing it that way initially. I had to realize that education is just as important for me as a teacher as it is for them as a learner. In order to reach my parents, I had to create a project that met them where they are and bring them to the forefront of what was important so I could put myself in their shoes in order to create an educational project to be more effective. My initial research and evidence was motivated by the patients that I see on a daily basis and the consistency of health-related issues associated with their obesity. Our numbers are high, and inactive parents and children are such a young age that the problem is increasing. Children follow by example. And if caregivers are leading sedentary lives and make unhealthy nutritional decisions, children will only follow suit. So many cultures are providing meals that were handed down for many generations, and changing the eating style that they feel is not a problem poses another barrier. General education had to be done to encourage healthy eating overall without pointing the finger to their caregiver specific habits. It is important to carefully, indirectly educate, leading them wanting more and not discourage them. In order to be effective, we have to better educate ourselves as nurses on how to reach our patients with best practice of evidence-based research. The outcome was different from my expectations initially because I was basing things on what I knew needed to be taught without adding in the most important component of cultural aspect in teaching. I needed to better understand my audience in which I was trying to teach, as well as what I wanted them to understand and know. I learned that after speaking to the providers on what barriers they were experiencing in the matter, I then had to seek out articles and educate myself on the best way to educate them. It was also important to research my demographic of my audience as well as how their environment affects their willingness to learn and make those effective changes. This helped utilize their environment and mindset to create a patient-centered plan that was realistic and achievable for them. So I'm not setting them up for failure. I felt good about my project. We actually had a nurses meeting yesterday, and I laid out color copies of my pamphlets by the sign-in sheet without saying anything. And I noticed a lot of nurses took one and was reading it during the meeting. At the end of the nurses meeting, they wanted to know why we didn't discuss the obesity prevention resources in the area. I explained that they were pamphlet samples for a school assignment, and I just wanted to know if they felt it was realistic information to them. It met with great positive feedback, and I was asked to assist the assistant nurse manager in making a presentation for our quarterly staff meeting that included everyone, not just the nurses. So I say, in all, it went pretty well based on the outcome of responses, about 25 comments from different nurses that were present. What I took from that was a small bit of pride and accomplishment, and the assurance that if I had to implement it for an actual clinic, it could be an effective piece of literature for with a few slight deviations and revisions. I was effective in using technology for the project because I was able to create a pamphlet that was user friendly, creative, and a learning tool for a parent and the child. Technology was effective in researching my current demographical area of needs and realistic resources available to families in need of healthier nutritional resources. Technological researching where we stand in the US in obesity and Georgia, I knew this was not a small problem. The government CDC, which is the Center of Disease Control, U.S. Department of Agriculture and Healthy People 2020 are working diligently together to find ways to combat the epidemic of obesity in children that leads to obesity in adults. This movement helped create educational initiatives in schools and daycares to influence healthy behavior. This was my motivation that I was on the right track in my choice of health issue, of choosing the health issue. I was guided by current government health policies to create a professional project that piggybacked on what they were already proposing and is what is actively in effect. My personal contribution came from experience in providing nursing care to my patients who are borderline obese or actually obese. As a home care nurse in my other job, I also was able to bring the experience of my adult patients that express being obese as a child with similar health issues as they do now. This made the project more relatable and realistic. In turn, I had a better understanding of where my patients are coming from so I could be more centered in their educational process. I also experienced educational growth as I was also better able to educate my own family on healthier eating and lifestyle habits. In conclusion, taking into account that as a nurse, it is my job to effectively give my patients the education they need to make the best health decisions for themselves. I also must provide this education without causing any harm intentionally or unintentionally. So I have to put my own bias aside in my effective teaching that I need to do for my patient. That gives them the best ethical standpoint that I am able to present. I also must provide this education without causing harm. It is our ethical duty as nurses to provide care to individuals and families in order to promote health and safety while preserving personal dignity and growth. It is the nurse's job to contribute and collaborate to promote health initiative and human rights while maintaining integrity. In research best practice from my families, I am providing best practice for holistic health policy. They only change, the only change I would make in my capstone project would be to take into consideration the ideas presented at my nurses meeting that incorporated actual context of persons and locations, making my school project a realistic implementable pamphlet that I could professionally present to my organization for distribution. What I am most proud of is the fact that I was able to create something that could be a real benefit and contribution to my community that I am actually able to implement in my workplace currently. Thank you.